Hey everybody, this is Brian Boudreau. I'm here with Director of Health, Sigalle Reiss. And just so you know, before we get started, we are sitting 6 feet apart and practicing good social distancing. So Sigalle, welcome to the studio.
Great. It's always a pleasure.
Always. So just to get started, obviously you and NCM have been doing updates since the very beginning with COVID-19 throughout the different phases. Can you kind of tell us where we stand now as opposed to where we were maybe back in early March?
Yeah, for sure. We've made a lot of progress. Think about when we started this really the first week in March and we declared the state of emergency. And we saw a very steep increase of number of cases per day and per week. Because we're just on the community level, I tend to look at the week-by-week numbers because the numbers are smaller when we look at just NORD versus the state report, which is a day-by-day report. So our week-by-week numbers definitely increased steeply from beginning of March to about the first week in April. Where we saw about over 100 cases, new cases in 1 week. That was definitely our peak. And we've come right down from there where we've only had less than 10 cases each week in the last few weeks. So drastic reduction in the number of new cases.
Okay. We're currently in phase 2, and we'll be moving. Where do we stand as far as town buildings opening?
Sure. We just entered into phase 2, step 2. So they've divided some of the phases up even further. And as we move into, so office buildings are allowed to be open. At Town Hall, we do think we're going to stay closed for a bit longer, probably around Labor Day. Because just because you can open doesn't mean you have to. If the governor's advisement still says if you can telecommute, if you can work from home, you should continue to do so. But they have allowed offices to open up to 50% of occupancy. So that will allow other, offices can be open, but just because you can be open doesn't mean you have to. So with our discussions, we do believe we'll keep Town Hall probably closed to the public. There are employees going in there, and you can do things by appointment. So we can pretty much meet all the services we need to at this point with keeping the building closed. Some of the other buildings in town, like the Civic Center and the library, we're having discussions about when we can open those. And again, not necessarily the day that we can. For example, at phase 3, fitness centers can open, but we're not sure we're going to be ready to open the Civic Center at that point. I mean, they got a lot on their plate. They're all the extra precautions they have to take in the programs for the kids, the summer camps, and the pools. They're pretty stretched, pretty thin right now with the amount of additional precautions they have to take with their programming. So to think about opening up the Civic Center, maybe in the next week or two, probably isn't likely.
Okay. Now you touched upon earlier services, and obviously something. Service that has become obviously a necessity really in Norwood is testing. And I know Norwood Hospital was offering COVID testing to Norwood residents. Can you tell me a little bit about how to get tested, where to get tested, things like that?
Sure, we've come a long way with the availability of testing, and it's another thing that's dramatically improved. So at the beginning it was very restrictive, where you could only get tested if you had symptoms. At first it was, I think, if you only had symptoms and you were exposed. At this point, if you have any symptoms, you can get a test, or if you've been in contact with somebody that had symptoms that was diagnosed. If you are designated as a close contact of a case, we want to get you tested. But really, through our community testing program in partnership with Norwood Hospital, we have pretty much opened that up to anybody. You can call the number at the hospital, make an appointment, and schedule a test. But I do want to say the testing is for viral testing, so it's testing to see if you currently have the virus. There is availability through other programs of antibody testing, but there's still a lot of questions we have with antibody testing. The accuracy of it isn't great, and even if we know, even if you show up and you have the antibodies, we don't really know what that means because this is a new virus. Something like measles, we know if we can show immunity in a blood test, an antibody test, we know exactly what that means. We know that you have immunity. If you have antibodies to COVID-19, we don't know what that means. We don't know your level of immunity. We don't know how long that immunity lasts. The only thing it tells you is that at some point you were exposed, but it doesn't tell you any information that you could change your behavior. It doesn't give you a free pass out of, quarantine or allow you to not wear a face covering. It doesn't give you any of that.
So there's still obviously a lot of unknown. Is quarantining still required?
Yep. So we're still doing contact tracing. So anytime we have a positive case, our department reaches out to that individual. We actually have 2 ways. So the state. Let me talk about what the state has done first, because it's done in 2 pots. The state, when local public health departments got very quickly overwhelmed, I mean, we're not structured to handle a large pandemic like this, the state did stand up the Community Tracing Collaborative. So they partnered with Partners in Health and set up a contact tracing system. So because we did have quite a few cases in Norwood, we took advantage of that system pretty early on, where before a lot of other communities did. So that allowed us during those weeks when we had, like 100 cases in 1 week. That's just no health department can handle that, no local health department. So if there's a positive case in Norwood, you will either get contacted by the Community Tracing Collaborative, the CTC, or the local health department, or staff in my department. We will conduct the interview and determine who your close contacts are, and those close contacts will be asked to quarantine for 14 days.
Okay.
We also follow up with those individuals to see if they develop symptoms. And right now, we actually encourage them to get a test because they would fit into that pot where they have been exposed to a known case, and we want to get them tested.
Okay. This is kind of my own curiosity. How far deep does the contact tracing go? Do you go like people that were directly exposed, or people, does it go to a second level or anything like that?
Yep, you always just go to the first circle. So
Okay.
you have the individual index case and you interview them and you determine who those close contacts are. And that's determined by, they sort of draw the line of a 10 to 15 minute conversation within 6 feet. Now we are at a safe distance apart. So let's say if I was diagnosed yesterday, you would not be considered a close contact because we have some distance here.
Okay.
So a 10 to 15 minute conversation within 6 feet. And we know because it's those respiratory droplets, that's the main way that this virus spreads from person to person. So we would take from that individual in the interview, determine who those close contacts, and that's sort of the first ring. Then we would test those close contacts. So let's say the person has 3 close contacts, and the numbers are tending to be pretty low because we are doing really well with our social distancing and our stay-at-homes and things like that. So when we first started, our cases had 10 to 12 contacts. Now we're seeing an average of maybe 2 to 3 contacts for community cases. And I'll put sort of nursing homes aside because that is a large portion of our numbers. So with a community case, we conduct the interview, we determine that first ring of close contacts, and then we put them in the 14-day quarantine, and now we're getting them tested. So let's say there's 3 individuals in that first ring, and one of them converts and becomes a case. They test positive.
Okay.
That's when we go to the second ring. You don't go to the second ring of the contacts, close contacts, until that person converts to a case.
I get you.
So with some diseases, you might go to second ring, but it's mostly in epidemiology and contact tracing. You don't go beyond that first ring until one of them converts to a case, and then you sort of create another ring.
Okay. All right, that makes sense now. A word you hear a lot in the news and on in places is asymptomatic. And obviously, if you're asymptomatic, I believe you show no symptoms. And what does it mean if you're asymptomatic, as far as can you spread COVID-19 if you're asymptomatic and don't know it?
Yeah, unfortunately you can. So
Okay.
there are individuals out there that don't have symptoms that are walking around and they could be spreading the virus not knowing. And that's why everybody wearing face coverings is so important. The face coverings are less about protecting yourself, but more about protecting those around you, and especially those people that are vulnerable around you. Because like we said, you might not even know you have it.
All right. And on the subject of face coverings, obviously, what is your opinion as a health official? Are face coverings or masks effective?
Yeah, so more and more research is coming out about that, and they're showing that it can reduce the, even just a cloth face covering, so we're not talking about medical PPE.
So if you have like a bandana or something like that?
A bandana, a simple piece of cloth covering your nose and mouth and fitting pretty tightly. It shows that it reduces the chance of transmission to about 80%, reduces it by 80%.
Okay.
So that's pretty drastic, and it's not a difficult, it's not a heavy lift for most people to wear face coverings, but of course they are, and I do want people to hear this, that there are people out there that do have medical conditions of a variety of sorts where they might not be able to wear a face covering. So if you see somebody out in public in the grocery store that's not wearing one, don't assume they're just not wearing them because they don't want to. There might be a medical condition. And then, we want to make sure that that's a valid reason not to wear them. And if someone just doesn't want to wear it because they don't think it is effective, or they don't like the way it looks, or it's, that's unfortunate, and we want to discourage that because, like I said, it's really about protecting those around you. We want to encourage it, but understand that there are people out there that cannot wear face coverings, so we need to be a little patient and understanding with our community members.
Absolutely. And I know we kind of answered this in the beginning in the intro because I did say that we are sitting 6 feet apart and we're practicing social distancing, but I'm going to ask anyway. If we are more than 6 feet apart, say out in public or something, do you need to wear a mask?
So if you're moving about, so if you're going to the grocery store, you're required to wear it in any retail setting, grocery stores, or now that we can go into retail stores, because indoors it's a lot more likely for transmission. And also you're interacting, you're walking around, so you're gonna come within 6 feet of somebody at some point. So that's kind of where they drew the line and just determined if you're out and walking around in an environment where you're moving, you're going to come in contact with somebody, so you might as well wear the face covering the whole time. An example I constantly give at work is if you're sitting at your desk, you're alone in your office, or even a shared office, but there's adequate social distancing, you don't have to wear your face covering. But if you get up and you're walking through the halls, you're going up to get the mail, you got to put the face covering on, because chances are very likely you're going to come in contact with somebody.
I got you. Okay, that makes sense. Next question would be, wearing a mask, I mean, if you're going to be in contact with somebody, say 6 feet apart, for say more than 15, 20 minutes, is that okay? If you're, like, again, even if you don't have a face covering, I mean, obviously you and I are spaced far enough apart, but is there any type of time restraint on that?
Yeah, so
That's the word.
the way they draw the line is sort of a 10 or 15-minute conversation. Okay. And that's because it takes a significant amount of respiratory droplets. I mean, as we're talking, we're singing and yelling and moving our mouths, respiratory droplets are coming out. It's kind of gross to think about, but we spit on each other constantly. But first of all, the big droplets fall pretty quick. It's the very small droplets that will travel further distances. But you have to get a significant amount. So with a quick exchange, that's not going to happen, but more of a lengthy, and you think about 10 to 15 minutes is a pretty lengthy conversation.
Yeah, yeah.
Sitting across from somebody in a meeting room, and having a meeting, that's going to be considered an exposure. But that's why we're going to wear the face coverings and when we're in any interaction like that, because it reduces it, like I said, by 80%. And I do want to emphasize that more and more information is coming out that the primary way that this virus is transmitted is person to person. So we hear a lot about cleaning surfaces, and that's very important, but you're more likely to get it in person-to-person spread versus person to contact surface to person. And the way to combat the contact surfaces is good hand hygiene. Hand washing, hand sanitizer, constantly doing that, because even if you touch a contaminated surface, doesn't mean you're infected until you touch your face and introduce the virus into your nose, mouth, eyes. So if you have a contaminated hand and you practice good hand washing, that's another layer of protection you can do to protect yourself. So again, the primary way is person to person. There is obviously examples of how people have gotten the virus from contaminated surfaces, but it's less likely.
Okay. And again, like you said, it's mostly those respiratory droplets.
Yes.
Okay. Kind of looking down the road a little bit, what is the long-term outlook from your point of view as director of the health department?
Well, none of us can predict the future, and there is a lot of unknown, and I think that's what is so difficult for many of us, and difficult for me on an enforcement standpoint. A lot of what the rules are constantly changing for our businesses and for our society, so that's very difficult. We'll tell someone one thing one day, and then literally that afternoon, the state comes out and it's changed. So that's been very difficult, and we can't really predict that far into the future. The school guidance for the fall just came out today, and it is very cautious in that it's requiring the schools to sort of develop plans, 3 different plans for having students back at school, having a hybrid version, and then going back to online school. So I think we need to be flexible like that, because we don't know what the future holds. We don't know what this virus is going to do. I mean, Massachusetts right now has the lowest transmission rate of all the states, which is wonderful. So I think it's about, so for every 1 case, we're seeing transmission to another person of 0.67 or something. I'm not sure the exact number. But what that means is it's actually reducing. So a 1-to-1 transmission rate, you would keep the same number. Right. So every 1 person gives it to 1 more. If you have over 1, that means you're increasing your number of cases, okay, let's say per day or whatever measure you're doing. So you want your transmission rate below 1, and that's how you reduce the spread and reduce the virus in your community. So I just saw in an article this week that Massachusetts actually has the lowest transmission rate, which is definitely, and I would attribute that to the behaviors of people in Massachusetts. They're listening to the warnings, they're wearing their face coverings, they're washing their hands, they're socially distancing, they're doing everything we need to do, because we have significantly opened up, and to still have a low transmission rate is successful. And
we've really come a long way just in the past few months, because I believe at one point we were considered like a quote-unquote hotspot. But now it's, like you said, people are doing what they're supposed to do, and it's working. And sticking to the future for a little bit, again, I know you really can't forecast this, but second wave talk.
Yeah.
Is that something we have to worry about? Is that really, I'm just asking as a concerned citizen.
I'm cautious because I see what's going on in some of the other states that have gone a little further in the opening up process than us, and that they're seeing increases. I think if we continue to be vigilant, hopefully we won't see that second wave. But I really can't tell you one way or another what's going to happen, and that's what makes this so difficult.
Yeah, there's no, like you said, no crystal ball. It's really hard to just pinpoint it.
Yeah, I think looking long term, what we need to be optimistic about is it sounds like we are going to get a vaccine. Okay. So that's good, and maybe it'll even be our Moderna here, right here in Nord, manufactured here, which would be amazing. So I think that changed to. At the beginning, it was let's hope we can get a vaccine, because not all viruses have vaccines. Right. But now it does look like that we will get a vaccine. It's just a matter of when, which is a great step forward, as opposed to we don't even know if we'll get a vaccine.
Any timeline on that?
I mean, I will what Dr. Fauci says, but I think they're saying early next year, hopefully at the earliest. But I have read studies where it's more realistically in the fall. And interestingly enough, I think there's a lot of emphasis of when the vaccine will be ready, but then another huge mountain in the future that I'm looking at for local health is we would be one of the primary agencies administering the vaccine. I think with COVID-19, everybody that can immunize will be immunizing, from pharmacies to doctors' offices to local health. But one of the things that we have been planning for, and to be honest, it was a little bit more of our pandemic planning. Public health has known this pandemic's coming. We've studied the Spanish flu, and every public health student knows about pandemics, and we've been talking about it. So the media constantly says that we had no idea this was ever going to come. Well, yeah, we did. And it's just hard to prepare for something that only happens every 100 years or so.
Yes.
But most of our planning has actually been around mass vaccination. So we have plans that we've put together based off of our annual flu clinics about how we would administer vaccines to a large portion of our population. And I would anticipate as it first starts to come out, the most vulnerable people would be prioritized to get the vaccine, and then eventually we would have to vaccinate the whole community. So, I mean, just discovering and manufacturing the vaccine is a huge hurdle, and then we got to think about administering it to 80-90% of our population.
Absolutely. So it's a matter of when we're going to get it, but the health department, no matter when it'll eventually come at some point, the health department is taking steps, and they'll be ready to do it.
Yeah, we hope so. Again, it's not, we don't know the future. We don't know what type of vaccine it will be. We don't even know, so we can't order the supplies yet because we don't know what type of syringes it would come in. Different vaccines come in different formulations, and you need different supplies for them. So I mean, we can do things like buy our sharps containers and our Band-Aids and our alcohol swabs, but some of the supplies we can't even order because we don't know what the vaccine will look like.
I got you.
So I just hope who's ever developing that vaccine also ships it with supplies.
Yeah, right. A whole little COVID kit.
Yeah, hopefully. And you know what we saw with H1N1 when we did stand up and we did we went in the schools, because with H1N1 it was kids, it was youth, that was children that were more susceptible to it. We went into the schools and we did vaccinations. We had to give everybody the 2 shots. The state was very, very good because the state supplied vaccine, and they also supplied the syringes and the sharps containers and everything that we needed to go with it, because especially on our small community, town by town health departments here, it's hard to leverage enough to buy the resources. It's sort of like when the state works with the federal government. It's the same here. We need the state to make those large purchases for us.
I got you. Absolutely. Here's a good question. Let's say, hypothetically, I test positive for COVID-19, and then, I get 2 negative tests. Mm-hmm. Can I test positive again later down the road?
Yeah, so there's actually been a lot of discussion about that recently. If you test positive and then you recover, mm-hmm. And it's been a couple weeks, you might continue to test positive with the viral test, the nasal swab, because it's actually a very sensitive test. It looks for the DNA of the virus. So you might be fully recovered, but there still might be detectable pieces of the virus in your nasal passage. So what we actually rely on to release you from what we call isolation is more symptom-based. So there's a symptom-based protocol to release you out of isolation. And I won't go into that because it gets very detailed. But one of the recent changes that they've communicated to us is that, so let's say you test positive and you recover, and it was back in March. If you test positive again today, you would be considered a new case and a re-exposure. So they're actually giving us 6 weeks in between from your first, let's say you recovered 6 weeks ago and you get infected again, that's a new case. So we were hoping that immunity would last at least 6 months, but I think they're being very conservative, and they're saying if someone's reinfected with after 6 weeks, that's a new case, and you got to go into isolation, and all your contacts are going to be quarantined again.
Okay.
So that wasn't good news.
No.
But I think it's because we don't know how long immunity lasts and what type of immunity. You might not have full immunity until you have a more significant exposure. So that's, again, one of the things we need to learn more about.
And do you know how many active cases are in NORD right now currently?
Yeah, so that's always a moving target. I would estimate that we have about 20 active cases. So those are people in isolation. When we think about since the beginning of March, we have a little over 600 cases. So and I talked about sort of those 2 weeks in April where we had 100 cases each week. So 20 active cases is phenomenal. But also, in addition to those cases, you think each one of them has 1, 2, 3 contacts that we're also monitoring. So that's still quite a large number of people. Right. And we continue, unfortunately, to see clusters in our nursing homes. It has definitely improved from where we were. But they are getting routine testing. So what the state actually does is they come in and they test everybody, symptoms or no symptoms, so they can identify all cases and isolate them either in the facility, or if they're workers, they get isolated at home. So we are still seeing some of that in NORD, but we are seeing some community cases. Mainly, there was a lot of healthcare workers, people that work in nursing homes. But as we open up, we will see more. I do expect to see more cases. What I hope is that it's not an exponential increase, that we would just see a little increase here and there. And I think you're going to have cases until we have a vaccine.
A little bump in the road, so to speak.
Right.
Okay. What would your concerns be with reopening?
Well, that's one of them, definitely the increase. And also increase in cases, obviously, is the primary concern. The other concern is as we reopen, we sort of go back to our old habits and our old behaviors, and that it's going to be hard to be vigilant with the face coverings, with the social distancing, with the hand washing, with the cleaning of high-touch surfaces. Those things are going to get harder when we start to go into our old habits and our old behaviors. So what we're working on is to continue to create messaging around that, to remind people and change that messaging. We all know about that sign that reminds you to wash your hands. After you see it 3 or 4 times, you don't really see it anymore. It just becomes part of your environment. So you constantly have to change the message, restructure it, put it out in a different way to make sure people remember it and stay vigilant about it. So that's one of my concerns as we reopen and we start to lose all the new habits we've started and go back to our old habits.
Right, it's because it's almost like you waiting for things to go back to normal,
right?
But you still have to keep on top of things because we could end up back in the same situation we were in March. Obviously, hopefully that doesn't happen, but you just got to be on top of things.
For sure.
Do you have anything else to add?
Yeah, one thing that I think gets a little less attention. I think contact tracing has gotten a lot of attention, sort of the first step of it. But testing is really the first step. And first there was a lot of concentration on testing. And then I feel like contact tracing finally made it, because you could test everybody, and if you don't contact trace, it doesn't stop the spread. Right. So there's sort of 3 legs to it, and I think the third leg never gets discussed. So sort of the linear route is obviously lots of testing is very important. After you test, lots of contact tracing, because we want to isolate those positive people, and we want to quarantine their contacts so they don't spread it to anybody else. And the third one, which I feel like doesn't get a lot of attention, is the wraparound services. So that's a lot, actually that's been a lot of my role, where Stacy, our assistant director, has been doing a lot of the contact tracing, and now we were fortunate to hire a new public health nurse, Nick Crowninshield. They're handling the contact tracing. My role is, where I'm not a nurse, is the wraparound services. So we want to make sure those people, in isolation and quarantine, I should specify this, means you actually don't leave your home. I hear a lot of people are like, oh yeah, I'm quarantined, I only go to the grocery store. Well, that's not quarantining. I make sure to wash my hands a lot. That's not quarantining. Quarantining means you do not leave your home for 14 days. And as you can imagine, that's very difficult to do. And we understand we're asking a lot of people to do that. So the wraparound services are very important. So, I mean, we're talking simple things from food delivery, medication delivery. A lot of times people are out of work and they don't have sick time and they're not being paid. So, are they worried about their rent? Are they worried about paying bills? Childcare. How do they isolate from their children? Things like that can be very difficult. So we try to reach out to them and really get them anything they need, because the priority for the community is to keep those people isolated and keep their contacts quarantined. So I think that third sort of rung of how the system works, like, it's less talked about, but it's very vital.
No, absolutely. It's crucial, especially if you're positive you can't go anywhere.
Yeah, pretty much going anywhere.
I do have one last question for you. And you did touch upon this about a little bit with wraparound care. How else has your job responsibilities changed since all this started?
Oh, it's completely changed. When I think about, actually, as we start to reopen up, one of my other concerns is all our other duties and responsibilities in community will also start to open up. We talk about pools. Well, we license and permit pools and we inspect them. So we sort of now, with all our regulatory actions, we have double tracks. So we have our pool licensing, regular enforcement of those regulations, and then we have the COVID safety protocols on top of that. So it sort of doubles all our work, whether we're talking about recreational camps for kids or pools, or definitely with our restaurants. So it adds, not only do we have more work as things start to open, the work has increased for one license. We do the inspection with the pool, but then we also have to verify that they're following all the safety protocols for COVID. So as we start to open up, more of those routine work will start to happen also, which is going to stretch an already thinly stretched department out. We do the best we can, and I always ask people to be patient with us, because we are working very hard to get as much done as we can, but that's definitely a concern.
Absolutely. Now, as always, you guys are always working hard down on the Board of Health, and we appreciate everything you do.
One thing I want to add to that,
Yeah.
it's actually a great thing in Nord, and I've said it to a lot of people, is the support that the department has gotten. From the selectmen, of course, my Board of Health, and from the general manager's office. We've gotten support in all of our actions, which are not always popular actions that we're taking. Public health, is typically not popular. We say no a lot, but it's for the community safety that we do. And there have been instances in other communities and really across the country of public health departments not being supported by their town leaders, and have been threatened, have been fired because they were just trying to do their job. So I really appreciate the support that the department has gotten here, and it's really, I think, why we've been so successful.
Absolutely. And as you know, NCM's always here. Whenever you guys do your updates, we're always more than happy to get that out to the public, because obviously, again, it's not always what everybody wants to hear, but it is important for people to hear, and we like to help each other out.
Yeah.
That's all I have. I want to thank you very much for coming on. This was great. And that is it.